Dr. Paul here. I've got a 3-year-old who was well until this morning. Woke up with a terrible sore throat, I believe. We're going to go see what's going on. Let's take a look. Hi. How's it going? You're not feeling too good? No? You look comfy. Is that a good place? Hanging out with Mama? Yeah. So what's been going on?
Well, she's complained of her throat hurting. She's thrown up once today.
Okay.
Headache this morning as well, and fever.
Okay. Yesterday she was fine?
Yeah.
Like perfect.
Yeah, this all started this morning. Just woke up.
Wow. Okay. How high was the fever?
102.
Okay. All right.
103.
And how do you know that her throat hurts?
Well, she's been complaining. I did look back there and saw some
Stuff back there. All right. Is she eating, drinking?
She has drank some tea, some honey, and some lemon and On Guard.
Okay. Very good.
And then she had a piece of bread with butter and cheese stick.
All right. Anything else hurt as far as you can tell? Ears, tummy, nothing else?
Not that she never even complained about her stomach when she threw up. She said she was hungry.
All right. Okay. So, I'm going to take a listen to your heart, okay? Your lungs. We'll take a listen. Okay. You're so sweet. All right. So this is my stethoscope. We're going to listen to your, listen to your heart. Oh, it's beating fast. That'll happen with high fever or dehydration or pain, right? Cause the heart rate to go way up.
Yeah, you see dehydration. She hasn't gone to the bathroom, I don't think, today. So.
Yeah. And then I want to take a look in your mouth, okay? Can you open real wide and say, ah? Oh, very good. Wow, that's a really red throat back there. Nice job. Very good. Good job. You're very good at that. So what we're going to do, that's a really red throat. These are your tonsils, and your tonsils are not 1+, not 2+, but 3+. They're not quite touching, but they're pretty big. So we use a throat swab that has 2 swabs. We take it all at once, just swab the tonsils. You know, some people just go crazy. You don't have to do that. If you get a good swab on the edge, that's usually all that's necessary to get some of that bacteria. And then we do a rapid test. Are you getting tired of our waiting?
This is testing for what?
No. So we're testing for strep. The rapid test is an antigen test, and it just takes 10 minutes. You see these 2 little swabs? I'm going to be very gentle. Can you open real wide again? So say a big ah. Stick your tongue out and say ah. Good job. So that's all it takes. It's a little hard to see, but anyway, there's a little yellow yucky on there. YouTube land always worries that I don't have my gloves. It's amazing. You watch. I'm going to get tons of comments. Where's your gloves? I am not touching the yuck. I am going to carefully... Oh! Okay, that's a blooper. You can still run an antigen test on this, even though, darn, it went on the ground. Okay, that was a good one. That's the first time that's ever happened. This one that didn't hit the ground is our backup culture that goes into the swab that goes to the lab. And this one that did hit the ground will still be fine for an antigen test. She's so sweet. Do you have any questions?
No.
Okay, so we'll know soon. Just hang out, 10 minutes. We'll have an answer right away. I suspect it'll be positive. And then, we'll obviously treat it if it's strep.
Okay.
And if it's not, then we got to talk.
Okay.
I think it will be. But we'll take a look at that. So we're going to take this to the lab, get it going, and I'll be back. So our nurse is going to go ahead and get that throat swab started for the rapid strep, and then we'll set up the throat culture that gets sent to the lab if that happens to be negative, and I'll see you in the room with the results. Well, guess what? It was positive. Let's go tell the family. Hi. Well, guess what? It was strep. Surprise, surprise. Anyway, it's a staph and strep infection. So when I heard sore throat and then we saw that really red throat, I felt in the history of impetigo, I was pretty sure we're dealing with strep. The strep was positive, as I think you've seen. And does she have any allergies to antibiotics? No. So our usual first choice is a penicillin, and it's just easier in kids when you know for sure it's strep just to use amoxicillin because you can dose it twice a day and it tastes better than old-fashioned penicillin, Pen-VK, which is the other option. But if you have Pen-VK, it works fine, and there are some studies where you can actually give that one twice a day and it still clears up strep. So we treat strep with antibiotics because we're preventing rheumatic heart disease. There's complications from untreated strep. Although I do have a naturopath friend who says, most kids will be fine if you don't treat them. I think it's worth treating, and we're going to use amoxicillin at about 50 milligrams per kilogram per day, divided twice daily, and she's going to feel like a new kid in about 24 hours. So 18 to 24 hours, you feel almost perfect. It's so tempting if you're older, you feel so well, I don't have to finish my prescription. You do want to finish it because you want to wipe out that strep. She is contagious for about a day. And I recommend a new toothbrush in 2 to 3 days.
Okay.
Because that brush may have strep on it, and if you don't get rid of it, then after she's all better, you get your strep again.
So I do have a 9.5-month-old and a 6-year-old.
Okay. Very rare for 9.5 under 1 getting strep.
Okay.
But, if they're super close and you're kissing on the baby and it's a possibility to watch for. Okay. And then same with the other child. If they develop a sore throat, just call us. I mean, we've already documented you've got strep in the family. Or the impetigo rash. Sometimes strep will show up with just a fine bumpy rash anywhere on the body. It feels like sandpaper. It's slightly pink. That's called scarlatina. If that develops, that's with known strep, then you'd want to call for that as well.
Okay.
All right.
Thank you.
Well, I'm going to get busy on my computer writing the prescription. Thanks for watching. This was a classic case of strep. It came on exactly 2 days after that exposure to impetigo, which is just what you would expect. 1 to 2 day incubation period for strep after an exposure. And the good thing is you get better quick. You feel horrible when you've got it, but you're going to be feeling much better in 18 to 24 hours. Thanks for watching. I'm Dr. Paul.